review that has been written is very timely, because it is high time that we really look critically at the contemporary relevance of our medical heritage. I think the future of healthcare is really going to be lying in medical pluralism, and because no single system has got solutions for all our health needs, and therefore we need to critically review, what is our own. In that context, at a very broad level, I would say that, whereas at a policy level, you can see that India is one of the few countries which has adopted in policy a pluralistic approach, in that we recognize so many different systems of healthcare as legal systems. But in practice, we really haven't addressed the issues, and that is one deficiency, I would say, which I hope can get covered in the next version of this report. We really have to address the issues of how do we relate these different systems. We can't have them working in different silos. We have to see how do we, and I'm using this word very cautiously, how do we attempt some form of integrativeness across these systems, with all the difficulties that this endeavor has. I'm aware of all the difficulties, all the debates that she has referred to of the Shuddha Ayurveda versus the modernist and all this sort of a thing. But nevertheless, even today we have the National Rural Health Mission, and the National Rural Health Mission says we accept not only Ayush, but also local health practices as part of the rural mission. Now they say so, that's in their policy document, but in practice they don't know how to do it. And so on the ground you do not see how this tremendously bold policy of the National Rural Health Mission is put in practice. Once again, in practice they work in silos and they do distorted kinds of things. So it's on Indian medicine and folk healing. I think this is the first time that we have a report of this quality, of this order, which has clubbed these things together, that Indian medicine and folk healing. There are very few people who realize that India's medical heritage actually flows through two streams, and really the word Ayurveda, we have stereotyped it, and when we say Ayurveda, the etymology of the word Ayurveda is the Veda of Ayu, the knowledge of life, and we have stereotyped it to say this knowledge of life is only carried by physicians, scholars, people who have read textbooks and so on and so forth. But that's not what our heritage is about. Our heritage shows that the knowledge of life is carried in two streams. On one hand, the knowledge of life is carried by ordinary people, by households, by rural households, by folk healers, so to say. They also are carriers of Ayurveda, not the Shastric Ayurveda, but the uncodified Ayurveda, but it is a knowledge of life, and it is time to widen this definition, and particularly in a book that has been coordinated and authored by Shailaja Chandra, because she was the first secretary of the government of India to have in 2002, when they formulated the Ayush policy, to have put a clause 9 in which it made it the mandate of the Department of Ayush to also look into the revitalization of the community-based local health practices. This was a very historical milestone that came to take. I will now confine my remarks to one chapter of the report, which is pertaining to medicinal plant resources. As we know that in terms of the natural resources that our heritage uses, medicinal plants forms the bulk of the resources. Of course, we also have medicinal fauna, which should really also be looked into, the issues relating to medicinal fauna. And we also have medicinal metals and minerals. So we have something of the order of 6,500 species of plants. We have something of the order of around 350 to 400 species of medicinal fauna. And we have something of the order of around 70 items which are of metal and mineral origin. And all these are the natural resources. And really a chapter dealing with natural resources should actually cover the flora, the fauna, as well as the metals and minerals. One very interesting thing that has been pointed out in this report is the work of the Central Councils of Ayurveda and Unani, where for many years they have documented the plants that are used by local communities. It would be very interesting for you people in the audience to hear this, to know this, that as per a very reliable database that we have on the medicinal plants of India, we have around 6,500 species that are documented to be in use by the people of India. And out of these 6,500 species, there is only around 2,400 species that are documented in the literature of Ayurveda, Unani, Siddha, Swarikpa. So what about the rest? Where do the rest come from? And what you see is that the rest of those plants are the plants that are used by local communities, by the folk tradition. So you have almost twice or thrice the number of plants, because there's lots of overlap of plants that are used by communities, and only a fraction of them are actually documented in the literature. And this report has pointed this gap out and has sort of put this as one of the challenges, that can we take leads from the usage of plants that are used in the communities and try and bring them into our pharmacopoeias, and what would be the strategy, are much more sophisticated. There are at least 10-15 parameters on which they have been further studied. But the lead started from there, and somewhere along the line that work stopped, because you have a situation today where you have 6,500, which is the documented plants from reference sources. There may be more, but what has been documented is only of that order, and you only have a fraction of them which is there actually in our pharmacopoeias. So that's one of the challenges which is very interesting. I have never seen this kind of a challenge addressed in any other report. The challenge of bringing plants from the folk usage into our pharmacopoeias and posing the question, how are you going to do this? What is the methodology for doing this? It's a very, very important thing to do if we are to expand our pharmacopoeia. The challenge addressed in any other report, the challenge of bringing plants from the folk usage into our pharmacopoeias and posing the question, how are you going to do this? What is the methodology for doing this? It's a very, very important thing to do if we are to expand our pharmacopoeia. Rightly, this chapter has also looked at the whole issue of plants in trade. Out of these 6,500 species that are actually known to the people of India, the number of species that are actually in trade is a very small number. There is only around 960 species that actually are in all India trade. And in respect of these species, we do have a problem of supply chain management, which has been pointed out in this report. We don't have proper system for collection. We don't have proper programs for promoting cultivation among small cultivators. We don't have proper storage facilities for making sure that we can I mean, this is a general problem with agriculture. This is post-harvest management of our resources. It's the same thing that applies here. We don't have proper grading systems. We don't have, there's a recommendation which is very important, I think, that we start coding our plants, give a uniform sort of use information technology, give a uniform coding to our plants, no matter from where they are collected. We need to develop standards for the raw materials. We haven't produced enough dossiers on our medicinal plants. So I think all these are things which are very important in the management of our medicinal plant resources. There is one recommendation that I suspect was probably something that she encountered during, of course there are problems in the way we manage these resources, but there's one recommendation which is that we establish an institute, a specialized institute for medicinal plants. I think that while in principle this is a good recommendation, I think it would be a mistake to think of establishing such an institute, particularly in the government sector. We have